So I'm going to be doing the insulin infusion continuous IV demo. So I'm just going to start by checking my physician's orders and checking that it's transcribed on the mark correctly. So here we have Bryson, Scotland, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9. This patient has no known allergies. The date is today and now. So the ordered drug is Insulin R, continuous IV, at 2 units an hour, The goal blood glucose here is that it's 6 to 10 millimoles a liter, so we'll be titrating based on our patient's blood glucose. And then here we also have normal saline at TKVO. And this is signed by 2 transcribers. So my orders are complete. That is good. So I can go ahead and continue preparing. So I'm going to find the PDM for Insulin R, and that is what I have here. So Insulin R. This is a high alert medication, so I'm going to need 2 checks throughout my preparation. This is an anti-diabetic. May be administered by a nurse or a student nurse through IV continuous. And it's important here to note that we need to have D50W on the unit. And so I know where to find that in case my patient does have a hypoglycemic reaction. And I'm just going to keep going through. It's still Insulin R. The regular dosing for an IV continuous is 1 to 10 units an hour. We have 2 units an hour ordered, so we're okay with that. And then I'm going to check the compatibility. The compatibility states that this drug is compatible with normal saline. That is what we have for reconstituting, and that was what was ordered for a TKVO. So compatibility is good. Some potential hazards for this drug are hypoglycemia. So I'm going to be assessing my patient for that and ensuring that he is okay. And then I know what to do if he does have a reaction. So then here I'm also going to look at the reconstitution and dilution information. And go down to IV continuous here. It says I need to use a Kaylee Guardian software, so I will use that when I'm on the pump. I need IV tubing free of side ports, so I have a straight set here. And for the drug, we need a concentration of 100 units per milliliter, and that is what the insulin that I have selected. The dilutant needs to be 100 mLs of normal saline, so I have 100 mLs of normal saline here. Final volume is 101 mLs. The final concentration is 0.99 units per milliliter. So I'm going to start by doing my first check with my drug, my diluent, my MR, and my PDM. So this is Bryson, Scotland. I've already confirmed that I have the correct patient with the physician's orders. No known allergies. So with the right drug, we have Insulin R. This is Insulin R, and this is Insulin R. This is to be given continuous IV. I'm using the PDM through the IV continuous recipe to prepare this correctly for a continuous infusion, and it will be reconstituted to be able to deliver it in that manner. This is ordered at 2 units an hour, so that's the correct dose. Through the PDM, I will be reconstituting 100 units of insulin, and then we'll program the pump to be able to deliver 2 units an hour. And then it is due today and now. And then I'm just going to double check here that I have the correct diluent. So I have 100 mLs of normal saline, and I have confirmed that. So I'm going to go ahead and start preparing my medication. So it states here in the PDM that I need to use a 3 ml syringe with an 18 gauge blunt fill, and that is what I have. I've confirmed that.
Looking at the recipe, I'm going to choose the first one, so it's from my pajamas.
I clean the top. I'm cleaning for 30 seconds and allowing that to dry for 15.
55 grams per ml.
And then throughout my preparation, I would be performing hand hygiene. This is getting stuck. I would be performing hand hygiene appropriately throughout while I'm preparing this medication. So it's dry now. I can draw up 1 ml of air to insert into our vial.
And some potential hazards are respiratory depression, bradycardia, hypertension, nausea, and vomiting. So I'll be monitoring medications for those. Alright, so now my first check with my mark, and then medications.
So I need to ensure that I have 1 ml in here, and I will create a label for this. I want to ensure that I'm creating a label because this is a clear fluid and I could get it mixed up at any time. Oh, that's an awful pen. So this is insulin R. The dose is 100 units. As I've checked on here and I've checked on the PDM, the volume is 1 milliliter. I confirm that I have 1 milliliter in this syringe. I'll show it during my second check. The diluent, there is none. Concentration, here is 100 units.
I'll wash my hands first.
It is today.
Before I get started, I'll just swap
Now,
my medication
for
vials.
K. Smith, UMSN
For the
3.
purposes of this demo, I'll just be using 1 swab for each. But in a real clinical situation, I'll be using 1 swab for each vial. And I would have swabbed it for 30 seconds and wait for 15 to dry.
Okay.
Since I need 10 mils of medication, I will be using a 20 mils.
So now that I've prepared this, I can go ahead and complete my second check. It is important to note that at this point, I will need a second nurse to complete an independent second check after I have completed my own second check. So I'm going to go ahead and start this. We have Bryce in Scotland. I've confirmed this with the physician's orders as well. This is insulin R. Here we have insulin R. This is continuous IV. This is to be given continuous IV. I will reconstitute. And I'm following the insulin R PDM recipe for IV continuous. So the orders for 2 units an hour. I'm prepping this medication with 100 units in this mini bag. And I require a concentration of 100 units per milliliter. Here we have 100 units per milliliter. And I'm confirming that I have 1 milliliter of insulin in my syringe. Okay, and then finally, I also need to confirm that I have the correct diluent, so I have 100 mLs of normal saline. And then for final right date and time, it is due today, it is due now, and no one has signed for it yet, so I'm able to go ahead and continue this. At this point, I would have a second nurse come complete their independent second check. So they come, they approve, and I'm able to inject in my mini bag now. So I'm going to go ahead and clean.
I'll just close my... And I realized that I don't have enough cell line on my syringe, but as you can see, the vials are both empty, so in a real clinical situation, this would have the correct volume of these vials. After this,
And then this and my vial would go into med waste. So I'm going to lightly mix this, and I'm going to create a label for my mini bag here. So we've got BS, insulin R. The dose is 100 units. And I've confirmed this with my vial. The volume is 1 milliliter of drug. The diluent is 100 mLs of normal saline.
in a real clinical situation, I would have only used...
The concentration is 0.99 units per milliliter, as I confirmed on my PDM. The date and time is today, and is due now.
30 seconds, wait for 15 to dry. And in a similar manner, I would inject some air.
And then I would have my second nurse sign this as well to ensure that they have also completed their second check. So here's my label. I still have to add to this part. So that is my completed label that I will put on my mini bag. So now that my checks are complete, I can go to the bedside. So to the bedside, I'm bringing a swab, a syringe to ensure that the patency, and some portless tubing. So I'm entering my patient's room. I'm doing my entrance safety check. Hello, my name is Kaylee. I'm going to be your student nurse today. I'm here to give you an insulin infusion. The doctor has ordered an insulin infusion for your high blood glucose so that we can control your blood sugars and your diabetes while you're here. So With insulin, you might experience some side effects like hypoglycemia or low blood sugar. So if you start to feel sweaty at all, if you start to feel any heart palpitations, you start to feel sweaty or hungry, we're having blurred vision, please let me know and I will come assess you immediately. It's really important that you let me know. Are you okay with receiving this drug? Excellent. And throughout this continuous infusion, I will be assessing your blood glucose and your vital signs often to ensure that we can get them within the correct range that the doctor has ordered. So I'm going to complete my third check. So here we have Bryson, Scotland. I have that on my tag as well. This is the fin, 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. Can you tell me your name? Good, and what's your birthday? Great. And Bryson, do you have any allergies? No? Okay. That's excellent. So I am going to go ahead and prime my tubing.
But in a real clinical situation, I would have time. It's a final concentration of 50 micrograms per ml in this syringe. And I have my normal saline here, which is 40 mils. My normal saline for my
good.
Normal saline bag.
I will ensure that that is clamped.
Final label says normal saline 40 mils.
And hang this to 5 minutes. So unfortunately in the lab setting, our tubes are sometimes already filled with saline. But in a real setting, I'm going to be conscious of the fact that I am trying not to lose insulin at all because we want the full dose. So I'm going to go ahead and prime. I'm going to keep this cap sterile.
Before going any further, I need to, as a student nurse, I'll grab 2 other nurses.
I will keep that sterile.
Double check my work.
So I'm going to prime my line.
Everything matches, so now I can just combine my diluent and my medication. To start that, I will retract my...
prime it, let's go away. And being conscious not to lose too much insulin. That's the old stuff that's coming out of this tubing. So it is now primed. There's no air in my line. I can recap this to keep it sterile. And I'm going to insert into my pump right away. So for primary, I'm going to open.
This would go in the sharps container in a bit. I'll just remove the bubbles and make sure that it's all the way.
So now that that's loaded, I need to ensure that I'm using the colleague guardian setting. So I will be using the colleague guardian, and then I'm going to go find insulin. So we have insulin, select, we have insulin, and I know that I have insulin. So the drug amount is 100 units. We have 100 units as per my PDF. The diluent is 101 mLs of normal saline. I've confirmed that that is what I have.
Hi, my name is Christian.
The concentration is 0.99 units. We have 0.99 units. And I'm going to be giving it 2 units an hour. The dose here is ordered at 2 units an hour, so I will do 2 units. It has calculated the rate for me at 2 milliliters an hour, and the volume is 101 milliliters an hour, and I've confirmed that. At this point, I realized that I have missed my 3rd check, so I would backtrack and complete my 3rd check as I'm going to do now. So I've confirmed that this is Bryson, Scotland, and I've confirmed with the patient. So here with my mini bag, we have Bryson, Scotland. This is Insulin R. Insulin R is to be given continuous IV. This is going to be continuous IV through that Y site. This is at 2 units an hour. It's ordered for 2 units an hour. We have 100 units in this bag. The diluent is 100 mLs of normal saline. It is due today. And now has not yet been signed for, and it is signed by me and my 2nd nurse. So there's my 3rd check. So my pump is set up. It is also important to note that with such a small infusion rate, that we do have our carrier here. This is normal saline running at TKBO. This was ordered by the physician. This is to ensure the patency of our IV while we're giving this very slow continuous infusion. So I'm going to assess the patency of my patient's IV.
Notice that the patient is currently running normal saline TKBO here. And I'll just follow the line. to my patient's IV. Looking at the IV, there's no redness, swelling, or any other infection. Patient doesn't complain of any pain.
That's primed.
And following the line of to my patient's PCA, everything looks intact. Alright, so now I can...
And there I have my patient's
do you consent to this medication? Patient said yes.
IV is patent. I can hook them up. I know that nothing is going to go through as my clamps are on, and it is hooked up to the pump.
I'll undo my blue cap.
So before I start this, I will be assessing my patient's blood glucose and the vital signs, and I will ensure that I can get the blood glucose within an appropriate range as ordered by the physician. So I will be doing those, and I will be monitoring my patient for hypoglycemia as well throughout this. So we are good. I don't have any clamps on. This clamps are good. Everything is running smoothly. So I will confirm my primary. Doing my assessments, I provided patient education. I've done my third check. I've checked all these. I've checked this to this. And before I press start, before I would have attached this to the patient, I would have had a second nurse come complete a second independent check to ensure that I programmed this pump correctly. So with that being said, I would then attach this to the patient, ensure the patency, provide education, and assess the patient's blood glucose and vital signs, and then I can press start on this patient's continuous infusion. So here I can see that it's running. It's labeled insulin here. I'm looking for 3 drips coming out of this. And then before I leave the room, it is important that I lock my pump.
I'm gonna grab 2 nurses.
So we can see here that it is locked. This is so that no other person can come and change any of these rates. It's really important that we keep it at a normal rate so as to not cause any harm to our patients. So there's no clamps. Everything is running smoothly.
For the purposes of this video,
perform my exit safety check, and then I would sign my MAR.
I would close this and lock it properly, and then press start.
So on my MAR, I would sign my name,
Flash, green light,
my initials, my designation. My second nurse would also sign the MAR, and I would say at what time I started the infusion. This is an awful pen. I am very sorry.
Has the PCA button within reach, and they're aware.
And it is complete.
And then I'll